Good afternoon, everyone. It is 2:30, so we will get started now. Thank you for joining us for this media brief. A reminder that ASL interpretation is available. Search for the window for interpreter stubs and hover over the three little dots to the right in the window to lock it in place. Health and Welfare Director Dave Jepson will begin the opening remarks, and then we'll hear from Public Health Administrator Elke Catherine Turner and Idaho Bureau of Laboratories Chief Dr. Christopher Ball. Idaho Immunization Program Manager Sarah Leeds is also in attendance today. And with that, I will turn it over to Director Jepson.
Thank you, Zach, and welcome everyone to our press briefing today. The overall state COVID-19 numbers continue to look really good. The statewide 7-day moving average of cases per 100,000 remains below 10. And the COVID-19 testing positivity remained below 5% has remained below 5% for the last 6 weeks in a row. The percentage of long-term care centers with active COVID cases is currently at about 7% or so, which is actually very good. COVID-19 hospitalizations and ICU stays are stable, but higher than we would like to see, and we do see variation across the state in COVID-19 hospitalizations. On the vaccine front, we have seen the overall doses administered continue to decline over the past 2 weeks. However, the number of first doses has increased a little bit during those 2 weeks. As the traditional school year comes to a close over the next couple of weeks, it remains our goal that schools can return to normal operations in the fall. We want to thank the many school district superintendents, school principals, teachers, staff, parents, and school boards who have worked so hard under trying circumstances to keep everyone safe while continuing to help our kids learn and succeed with their education. Which brings me to my final point, which is a reminder that anyone 12 and older is now eligible for a vaccine, and specifically the Pfizer vaccine. We encourage parents to strongly consider choosing to vaccinate your children 12 years and older. Doing so before school starts in the fall will greatly increase the chances that school can return to normal. Just a reminder that the COVID vaccine is free to those getting vaccinated and is widely available, including walk-ins at many pharmacies and healthcare providers. You can find a walk-in clinic that has Pfizer available, which is the only vaccine available for anyone under 18, or make an appointment at covidvaccine.idaho.gov. And with that, I will hand it over to Elke.
Thank you, Director. I have a couple of things I wanted to talk about today. First is an update from our last press briefing where we unveiled our Stage 4 Stay Healthy guidelines, which allowed for things like loosening of restrictions on sizes of gathering and encouragement to get the COVID-19 vaccine. So if you recall, as part of the release of those guidelines, we also updated our business-specific protocols on the rebound.idaho.gov site. Also, as you're aware, just a quick 2 days after the posting of those documents, CDC released their guidance on the use of masks for people who are fully vaccinated. That change in the CDC guidance drove an additional review of the protocols that we had posted that I just mentioned. So I just wanted to point out that we are currently in the process of updating those protocols based upon the CDC's released guidance. However, since that time when we started working on those, it's our understanding that CDC will be updating additional protocols for businesses, and so we are going to finalize our review of our protocols and guidance documents as those new CDC releases come forward. And we expect that CDC will be releasing that work this week, so please stay tuned for those protocols to be updated. I also wanted to mention, as I did last time, that we are offering our $9 million in mini grants for mobile vaccine clinics and efforts across the state. I'm very pleased that we have received 10 applications to date, totaling approximately $2.6 million of that $9 million. 7 of those applications have been awarded. 1 is pending and 2 are currently under review this week. The catchment area of those applications is mostly focused in the Treasure Valley over to eastern Idaho. We have a good representation from pharmacies, healthcare organizations, EMS, community organizations, and universities. and some really great partnerships that are forming in conducting that work. The activities are ranging from a focus on special populations such as farm workers, hotel employees, a specific focus on Latinx population, students and homebound, and then all the way from mass clinics to in-home services to drive-through locations. So we're seeing a good, robust spectrum of locations, activities, and populations that they're serving. Well, I'm absolutely thrilled to see the innovation response to the grants. We would like to see more partnerships and more providers utilizing these mini grants, especially in Western, Central, and Northern Idaho. So this is really my opportunity to put a plug out there or plug there for these mini grants, and using this opportunity to encourage communities to take advantage of the grants, the mobile vaccine grants, and make those applications and make sure that we get the opportunity to offer vaccines out where people live, work, and play. So we look forward to more applications coming in. And with that, I'm going to turn it over to Dr. Hahn.
Thank you. Can you hear me okay?
Yes.
Okay, thank you. Yeah, so I had two things I wanted to talk about today briefly. One is we are getting questions now because Moderna has announced that they are seeking FDA authorization for their vaccine that's already being used in adults. They're going to seek approval for use in 12 to 17-year-olds, and just how are we getting ready for that? I will say that we are very excited about that, especially because, as the director mentioned, if you have an adolescent that is seeking vaccination right now, they really can only receive Pfizer vaccine. Anyone under 18, it's only authorized, only Pfizer has achieved that. So we're very excited about this because we know there are some communities where it is hard to find Pfizer or it's not always in stock. So we're pleased to hear that's moving forward, and we hope that FDA makes its authorization and authorizes it. And once they've done that, and CDC has made recommendations for its use in 12 to 17-year-olds, which if all goes well, should mirror exactly the recommendations for the Pfizer vaccine with the usual intervals and so forth, then we will pivot and try to use that and make sure the providers are aware and parents are aware that now they'll have a choice. So we're very excited about that. Looking forward to that. We can't predict the timing, but certainly with the Pfizer vaccine, the FDA moved very quickly. So hopefully within weeks of Moderna completing their application to the FDA, we will hear about whether that's going to be authorized in that age group. The second thing I wanted to mention was that last Friday, we joined Washington and Oregon, and I believe California did as well, in issuing an alert to our medical providers to let them know that we had a few reports of myocarditis, which is an inflammation of the heart muscle, in people who had received one of the COVID vaccines. It's important to note that these adverse events that get reported either directly to the federal vaccine adverse events reporting system, or they can be reported to us in other ways. They can be done by anyone, and they don't necessarily mean that there was a causality. We know that we have viral myocarditis cases every year in Idaho. Nonetheless, because Washington and Oregon had seen what they thought was a significant bump, I'm sure you can find it in the media, but I believe Oregon reported 6 and Washington 11 cases, I believe. They were concerned enough that they wanted to make sure providers are aware. We went and looked at our information. We had 3 reports, and remember, this is among now over 600,000, I think, of Idahoans vaccinated. So it appears to be very, very rare, but we thought it was important because providers might be hearing from other states, and we want to make sure they were aware of what our numbers were. And more importantly, we want to make sure providers were aware of how to report those if they did see anyone with myocarditis and they thought it possibly could be related to having been vaccinated, that they do report that to us, or even better is to us and to the federal vaccine adverse events reporting system, so that CDC can continue to monitor this. You may be aware that CDC did come out with a statement initially saying that they had, looking at the information that they have received, they do not see any what's called a signal or cause for alarm at this point, but they urge providers to go ahead and make sure they're reporting this. We only know about things that are told to us, and so we want to make sure that providers were aware and knew how to report. Our health alert that went out did outline a little bit of information about those 3 reports. Of course, protecting privacy, but we were able to let them know the age range of these individuals was between 25 and 60 years of age. So we have not seen any, had any reported to us in adolescence. They've all been adults, and they are all recovering and doing well. And that was reassuring to us to know, especially because we know parents. I think I mentioned on our last press briefing that, my son just got his first dose of Pfizer a few weeks ago. There are a lot of parents like myself who are weighing this every day, whether to get their children vaccinated, and they want to make sure they have all the information and how serious of a concern is this, how likely that it's related to the vaccine. It is coming into summer viral season, where sometimes we do see cases of viral myocarditis due to other viruses that circulate at different times of the year. So we can't say for sure what's going on yet, but we just wanted to make sure everyone was aware. So that's all I had, and I believe next up is Dr. Turner, Kathy Turner.
Thanks, Dr. Hahn. So on that theme of kiddos, I wanted to share some brief updates about COVID-19 vaccination among our adolescents and teens. And Director Jepson mentioned that we really want parents to consider choosing to vaccinate their children who are 12 years of age and older. Although fewer children have been infected with the virus that causes COVID-19, when you compare them to adults, children can still get infected, they do get sick, and they can spread the virus to others. So in Idaho, the doses of Pfizer vaccine administered among teens 16 to 17 years of age really peaked the first week of May, and we're now at about 1,600 doses or so being administered to this age group each week. About 22% of those kind of older teens have received at least 1 dose, and nearly 16% have completed this series, the Pfizer series, and are fully vaccinated. As mentioned, the Pfizer vaccine was approved for use among 12 to 15-year-olds about 2 weeks ago, and as of yesterday, just a scooch under 9% of Idaho 12 to 15-year-olds had received at least 1 dose of the Pfizer vaccine, and we really hope that pace continues into the summer. We want not only for them to be vaccinated for getting ready for school in the fall, but we also want them to really embrace this summer after our summer last year. And this really significantly reduces the risk of them getting ill and spreading the virus that causes COVID-19. That was it for my update. I'm going to go ahead and turn it over to Dr. Ball.
Thanks, Dr. Turner. I'm just going to provide a brief update on our sequencing activities. The Bureau of Laboratories is continuing to assist with the development of sequencing capacity at multiple facilities throughout the state, which, as the summer rolls on, should really help us to deal with this pandemic, but also build some critical public health infrastructure to move forward, which we're very excited about. In the interim, though, we would like to increase the number of samples that we are sequencing on a weekly basis, and I'm happy to announce that we've just finalized an agreement with a high throughput out-of-state laboratory that has a contract with CDC. We'll be sending out our first large batch of samples this week, and if all goes according to plan, we should be able to triple the number of samples that we sequence every week moving forward, and that will only continue to grow as our additional partners in state develop their capacity. As the director had mentioned, our testing rates have really started to dip a bit, but thankfully the positivity rates have also been pretty stable. There have been a few locations where we've seen an uptick in positivity rates, which is concerning, and we've reached out to facilities in those regions and really asked them to submit additional samples for sequencing so we can try to determine if there are any unusual variants or unusual variant proportions that may be associated with those upticks in positivity. With regard to our most recent sequencing result, we are seeing several different variants of public health interest or concern circulating in Idaho. As we've mentioned before, the most abundant variant that we're seeing is the B117, the variant that was first identified in the United Kingdom. The next most common that we're seeing is a complex, the B.1.427 and 429. These were the variants that were first identified in California, and they continue to increase. Both of those variants continue to increase every week, just a little bit. We've also seen a recent increase in the P1 variant. This is the one that was first identified in Brazil, and that has really been a bit concerning to see that one pop up. And then we also have detected a few variants of public health interest, the B.1.526, which was first identified in New York, and also the B.1.617, which is currently widely circulating in India. So what's interesting is if you look at the composition of variants that we're detecting in Idaho and compare it to what CDC is reporting for HHS Region 10, which is Alaska, Washington, Oregon, and Idaho, we're seeing very similar trends in the proportions of variants in our region. So there's nothing really unusual about what we're seeing circulating in Idaho. But what it really speaks to is that we're seeing an increasing volume of these variants of public health concern, and it really serves to re-emphasize that message that vaccination is really important. As we continue to see variants circulating, the currently authorized vaccines have shown to be very beneficial in limiting disease, even with these variants of public health interest and concern. So I want to just echo the sentiments of everybody on this call and say, continue to seek vaccination if that's the right choice for you, and hopefully we can really start to minimize these new variants that are emerging. And that's all I have, so I guess back to Zach.
Thank you, Dr. Ball. We will now take questions from media participants. Please raise your hand in WebEx by selecting the hand icon, and you can also type your question into the chat area. When I say your name, go ahead and unmute yourself and announce your name and media outlet before asking your question. Okay, the first hand I saw was Melissa Davlin.
Thanks, Zach. Dr. Ball actually addressed most of my question with the hot spots around Idaho, particularly in places like Kootenai and Lewis County. So I guess the second part of my question, perhaps it's for Elke. I was curious if the state has considered implementing lottery type programs like we're seeing in other states to try and get some of the younger that younger demographic to put vaccination higher on their priority list.
Yeah, thanks, Melissa. I will say that at the state level, we are looking at everything we can to incentivize people, encourage people to get the vaccine if they want it. So I will say nothing is off the table, and we are looking at what we can do at this time.
Would that be a Department of Health and Welfare decision or something that you'd work with the other parts of the executive branch on?
Yes, absolutely. We'll be working with a lot of executive branch partners on a variety of levels, from statewide efforts to community-based efforts. So we have a lot of, I've been saying we're casting the net far and wide on things that we're trying to do to blanket the whole state, to blanket communities. So yes, yes, and yes.
All right, next up is Audrey Dutton.
Hi, Audrey Dutton from the Idaho Capital Sun. So it looks like from the dashboard, we currently have about 9 weeks of supply on hand. And I am curious, at what point do we have to give it back? Or is that something that we might have to do if we get up to more than 2.5 months, more than 3-4 months of supply?
Yeah, thanks, Audrey. I'll start the response and then turn it over to Sarah. I don't believe there's any restriction on us having, a large supply on hand. We're not obligated to give anything back. However, there's a federal program where we can pool vaccine if we want to contribute in a federal program. That is something that we're considering right now. But I'm going to see if Sarah has any additional input into any requirements from CDC.
Yeah, thanks, Elke.
As yet, there are no requirements for us to transfer any of our allocated doses that are unordered into that federal pool right now.
Thank you.
All right, Melissa, I see your hand is still up. Did you have another question?
I do. I was curious about the rate of vaccinations for 9 to 12-year-olds. You had said earlier that you hope that that pace continues, that 9% have currently received their first shot. How does that compare to the rest of the country looking at that 9 to 12-year-old group? Is that slower or about the same pace as the rest of the country?
I'm going to see if Sarah wants to answer that and Dr. Hahn wants to follow up.
Okay, I was just going to try to pull up a national comparison because I don't have that number memorized if I've seen it. So I'll keep looking if Dr. Hahn might have some information.
Yeah, I just want to clarify. Are you referring to 12 to 15-year-olds?
I'm sorry, that's exactly what I meant.
Okay. Okay, that was question one. I just want to make sure, because just for Ben, I know I figured you were just misspeaking, but I just want to make sure everybody on the call realizes, 12 to 15-year-olds is our youngest group right now. And as Sarah tries to find that specific information, we know that we are, as you look on our dashboard, we have different age groups that we do compare to the national rate. I don't think we have a direct comparison just of that age group at this point because it's so early. If you think about it, our 12 to 15-year-olds, they're just barely getting they just got their first doses a few weeks ago and have just very few of them, if any, have completed. So we don't really have that comparison yet, but I think we're concerned. As Dr. Turner pointed out, we saw a little burst with enthusiastic parents, and we're already seeing some declines, and we're very worried with school about to let out, and getting vaccinated is the last thing on anybody's mind when it's summer, and we're very concerned that people will lose their interest in this, and we have a lot of work to do before school starts. I think the director mentioned early on, we really want to see school open successfully in the fall for kids. We know with the younger kids, there's not even a vaccine available for them yet, but for kids where there is a vaccine available, our best hope of having a successful school year is to have not only our teachers and staff vaccinated, but also the students as much as possible. So we will hopefully have that. Sarah, were you able to find anything? Like I said, I don't know if we have 12 to 15 available yet, but Sarah,
yeah, I'm not seeing anything yet. Sorry.
No, that's all right. Yeah, but that's a great question. We are concerned about that age group for sure.
Thank you.
Okay, next up we have Kyle Faunensteel. Kyle, I'm trying to unmute you. See if that works. Looks like it's not working. Maybe you can type your question into the chat area. For now, let's go to Rachel Cohen.
Hello, this is Rachel from Boise State Public Radio. I think it was maybe a couple months ago that we talked about vaccination goals for the state. And I know that's intertwined with the conversation about herd immunity, but I think the first one was to have 80% of the 65 plus population vaccinated by June 1st, and let me know if that is incorrect. But right now, the dashboard is showing 74.8% for that population receiving one dose. And I was just wondering if the health department believes that we are on track to meet that goal or not, and what do you make of that?
Excuse me, we'll maybe chime in, a couple of us here on this. Yeah, that is something that we talked about a few quite a while ago, actually, a couple of months ago. And we certainly want to see that age group achieves that goal. We're so close. And we're hopeful that some of the efforts that we have underway are really going to help get us to that, getting to that population even more. Making sure that we're getting services out into people's homes, getting them closer to where they live so it's easier for them to access vaccine, which is why we're doing things like offering those mobile mini grants. And we're also trying to do our best to incentivize and people in the communities and work with community partners to create events that draw people into them and help get more people vaccinated. So Kyle, I see that you finally are able to be off mute, so I'll get to your question next. So the great point, Rachel. We do want to keep pushing to make sure that we're getting the older populations vaccinated for all the reasons we've talked about in the past. And I feel, like I said, we're very close. We're very hopeful that we'll be able to achieve that through some of the efforts that we have going on. Zach, should we move to Kyle's question?
Yes, Kyle, are you able to speak now? Kyle? Okay, maybe you can just use the chat feature. It looks like it's not working. In the meantime, let's go back to Audrey Dutton. Do you have another question?
I do, thank you. What are we seeing in terms of transmission demographics now that folks in older age brackets are more vaccinated? What are the proportion of cases that are among, each age group at this point?
Dr. Turner, do you want to take that?
Yeah, thank you, Elke. Audrey, I think I may have mentioned this the last, maybe 2 times ago, that the average age of our cases has dropped considerably since January 1st by about 4 years, to be exact. So what we're seeing is even though our cases are fewer, we are seeing the cases that we are identifying tend to be in the mid age range, so between 30 to 60 years old. That's kind of where the bulk of the cases are. What's really important though is that the proportion of cases that are being hospitalized is going down, as now that our older age group is protected, which is really indicative that we're not seeing a severe disease. But yes, the answer is, in general, we are seeing a reduction in the mean age, the average age of cases. And I can get you more specifics maybe offline for those proportions if you'd like, Audrey. Happy to do that.
Yeah, that would be great. Thank you. I've just seen from some other places, 55% of new cases are now among 16 and under and things like that. So I was just wondering about that. But yeah, if you could get that to me, that would be awesome. Thank you.
We'll do it.
Okay, next let's go to Melissa Dafflin.
This is kind of related to Audrey's question as far as transmission going on right now. Dr. Ball, I know you said earlier that we don't necessarily know how variants are playing into this at the moment, but is there still active contact tracing going on? Do we know why there are so many, that rolling average case rate is so high in Lewis County, for example?
Thanks, Melissa. I'm not sure I'm the best person to speak to contact tracing, because that is work that's typically done by epidemiologists in the public health district. So I really can't speak to that. I can say that in that panhandle region, we are seeing a number of different variants of public health concern, but perhaps Dr. Turner or Dr. Hahn may be able to better answer that question about the cases.
Yep, thanks, Elke. So yes, we are seeing a little bit of a bump up in the Panhandle region. There is contact tracing, active contact tracing still happening. What we have found though, and I'll just be honest, is that people are a lot less likely to cooperate with public health when they're doing contact tracing activities. But active contact tracing is going on. If people have been exposed and they're not vaccinated, they are encouraged to go get tested or to watch for symptoms. So all of that is going on, and Panhandle Health District is really the agency in charge of sort of doing that applied shoe leather epidemiology up in the Panhandle, and we're in regular contact with them. They have not reported any specific outbreaks or clusters to us, so it does seem to be sort of a community-wide increase that's going on right now.
Okay, it looks like Kyle's question was answered already. So next up we have Ian Stevenson.
Thanks. I'm from the Statesman. Regarding the possible upcoming authorization of Moderna for adolescents, Dr. Hahn mentioned that some communities have been having trouble keeping Pfizer in stock or having it available. And I wondered if is that basically just because of the particular refrigeration requirements of Pfizer, or is there another reason for that? And also, I wondered if you could say more about whether there are particular areas that are having trouble keeping Pfizer in stock that might particularly benefit from having Moderna authorized for that age group.
Thanks, Ian. Dr. Hahn, do you want to?
Yeah, I could start, and Sarah Leeds may have something to add, but I will say that as we look around the state, we have our vaccine finder, we have other ways of looking at that. What we found is that there are some communities that don't have Pfizer, and I think you hit the nail on the head. The challenge with Pfizer vaccine has been that you have to hold very large quantity. You have to have, of course, the special deep freezer. You have to hold very large quantities at once, because the trays right now, the dose, I think it's 1,175 doses. Not everyone feels like they can use that many, so they come in just very large amounts. Good news is, and Sarah can confirm this though, that is changing. So we're hopeful that we can get Pfizer out into more communities because they are going to be able to send it out in smaller quantities, but I'll let her add on to that. I will say, of the communities that I looked at, and this was now probably a week and a half ago, 2 weeks ago, I did see some communities that I didn't think had a lot of Pfizer. They had vaccine, which is great, but they didn't have Pfizer available. You'd have to drive a ways to get Pfizer, and the local health districts are working very hard to make sure they're aware that adolescents need the Pfizer, and they're trying to fill those gaps. The one that I remember that leaps to mind was the Mountain Home area. And remember, we don't have visibility, and the base might certainly have their own. Many people get their health care on the base, and they may have had it just not visible to us at our statewide picture. But that's an example of where a parent might have to drive all the way into Boise, for example, to get vaccine, and we're trying to avoid that. We know that anything we can do to make it as easy as possible to get vaccinated is a good thing.
Yeah, Dr. Hahn, I would just add that with the addition of Moderna, their minimum shipment is 100 doses. And while it is a huge win to have Pfizer available in 450 dose minimum shipments now, that is still a lot to ship directly to one provider. So we are relying on our public health districts and our partnership with the public health districts to redistribute Pfizer to providers that really can't administer that much COVID-19 vaccine in the appropriate amount of time. So with the addition of Moderna, that will be just one more tool in our toolkit to get the kind of vaccine that the providers need to administer doses to all the people who are eligible.
All right, Ian, I still see your hand. Did you have another question, or are you all taken care of?
Oh, thanks.
All right, that looks to be our last question for the day, so we will wrap it up for today. We're planning another media briefing tentatively set for June 8th at 2:30 p.m., which is 2 weeks from today, and you can find the details about that on the Monday before. And thanks everyone for joining us.